So one was an ITU nurse, trainee nurse. So she'd come in, I think she worked in a different hospital. A trainee ITU nurse, she'd come in and had been in a hospital recently where she'd had her appendix removed. So appendix being removed, very, very common. A lot of people will have it. Now, after a major operation, normally you're a bit immobile, you might be in bed for a while, there's a risk of having blood clots, right? So immobility is a risk of blood clots in your legs, which can travel up into your lungs, what we call a pulmonary embolism, can be life-threatening. So this young 22-year-old was sitting in our what we call our triage area, a rapid assessment, and we were doing observations. And her heart rate was quick, like 130, 140, like yours, Indy, on that day. And she had some chest pain, she's breathing away, and we were like, yeah, this is definitely going to be a blood clot. You know, she's got the risk factors, she had a recent operation, she has the signs. And so, because it seemed so clear-cut, we gave her the treatment for a blood clot, which is a blood thinner, okay, to thin out the blood, which prevents more clots essentially forming. And then we sent for an X-ray. So it's pretty standard thing to do. The X-ray isn't the thing you will see the clot on, but we do an X-ray because it's quick and we want to make sure that there's nothing else like a chest infection or what we call a pneumothorax, like in that film Three Kings, George Clooney at the start of the film, where you have air in the wrong space. That can also cause these types of symptoms to a young person. So it came back, and so, you know, on an X-ray, a 22-year-old, the heart should be pretty small, kind of like this kind of shape. Her heart came back and it was like big. Ooh.
Well,
and we were like, yeah. But like in a large heart in elderly age, again, very reasonable. Somebody could have heart failure. That we know, right? But again, 22-year-old shouldn't have this. It's a big heart, and we're like, oh, bloody hell, what the hell's going on here? Turns out this lady has a condition called cardiac tamponade, which is a super medical emergency. What's happened here is she has, so your normal heart has a couple of layers, like it's got like, just think of it like membranes, 2 or 3 membranes, right? And in between the outside of the heart and this other membrane, there's a bit of fluid. That's lubrication, allows it to move. Normal person will have about 5 to 10 mils of this fluid. That's normal, just lubrication. This lady had loads and loads and loads of fluid in there. The problem with that is in the same way, if you put fluid into the brain, around the brain, the skull is fixed, right? And eventually the fluid has nowhere to go, and so it will start pressing on the brain. Okay?
Yeah.
So in this context, what can happen to the heart is, if the heart is surrounded by so much fluid, the heart has 2 functions. It relaxes, and when it relaxes, the heart fills with blood, and it contracts, and the heart gives that blood. That's all it does, right? Fill and pump, fill and pump, fill and pump. If you have fluid all around it, it means that the heart cannot fill. If the heart doesn't fill with any blood, nothing's going to come up in your pump, and that will lead to cardiac arrest, i.e. your heart will just stop and you will die. So this 22-year-old is there, and we've realized, like, oh shit, this is what it is. And so we need to confirm this now. The X-ray is just suggestive. So we like what pregnant ladies have, the ultrasound of the tummy. We get the heart doctor, the cardiologist, to come and do a scan of the heart. She's then, and it confirms it, she's then rushed to the cardiology ward, and she has to have what we call pericardiocentesis, which is a needle about this big.
Yeah.
Big needle, right, which goes underneath. So they got the breastbone here.
By the way, when Karan says this big, I'm talking like how many inches?
Big, man, like, I don't know.
A 30
centimeter ruler, yeah, 30 centimeter ruler.
Okay.
12 inches. 15 inches? 12 inches, right. So underneath the breastbone, the sternum, 45 degrees, bang. And you're trying to hit that space. You're trying to hit the pocket of fluid to relieve the pressure.
Yeah.
Now I'd actually gone home at this point, so this was the next day when I was hearing about it. And apparently it took like 2, 3, 4 attempts. You know, they're getting the consultant to come in from home.
Yeah.
So he's on call, like he doesn't normally have to come in unless it's something like super emergency that, you know, the registrar can't handle, and he's having to come in, and thankfully everything was okay. But yeah, it just reminded us that even with years and years of experience, even when it looks, you know, like what we thought it was, it can be completely something different, and things do catch us out. And again, you know, on your stag we play poker, and I often say to people that with medicine, when I look at people, the point of having experience is that because you've seen so many different variations of different conditions, you're bagging on that. You're playing the percentages game. So like in poker, you're like, what's the probability of this and this?
Yeah.
Like when I turn that card over, is it going to be a flush, right? And so that's what we're looking at. We're like, okay, common things are common. We got this, and this. It's going to be this. But we still get it wrong sometimes, and I think people need to understand that, you know, they say medicine is an art, it's not a science. There are some things we know for sure, and other things, you know, we're making very, very educated guesses. You know, sometimes it's well, this looks like this. Let's do this. What's the harm if we do this? If it's not this, let's try this. So yeah, it was just a stark reminder, and that's the chronicle that of this week. So it's not, rather than being like a funny story, it was just more. Yeah, every day is school day, man, and we won't forget that now. And if that presentation comes again, it's get the X-ray very quickly. Don't give the injection, and let's take it from there.
So you saved their life, innit?
Yeah. Well, as a team, as a collective.
Yeah, but a nice happy ending, please.
Yeah. Absolutely.
Thank God.
Absolutely.
All right, I needed that after this heavy week of abortion and 9/11. Yeah.
And Cheryl Cole.
Whatever. Cheryl Tweedy, Cheryl, whatever you want to call her. That goody, that lady. Right.